Hello, my name is Vainius and I'm a physiotherapist. I like to give some pain relief exercises and glute activation exercises. So for the first thing, it's very important to have as maximum range of motion as we can have it and as strong muscles as we can get it. Because after the operation it will be important to have very strong glutes and relaxed muscles. It will help to achieve better results in rehab. So for the first exercise I usually use some harder ball with a soft surface without the spikes. We can use it to unload the pressure on the hip by relaxing the muscles. So it should go like you apply pressure to the ball and you massage the whole muscle as much as you can. Where you will find the most painful spots, you can go there a little bit more. Just keep that place massaging and you will get the best results when you will massage and don't have no pain in the glutes. Next exercises, as I talked, is very important, have strengthening exercises for the glutes and the hamstrings. So all the exercises where you can do the bridge is a very good exercise. You lay down on your back, the foam roller or something which can raise your knees a little bit higher. You lay down, activate the abdominal muscles and glutes, and you can lift a little bit pelvis and hold it for a few seconds and you put it down. And again, you lift it, you hold it for a little bit and put it down. And this is how you can do 10 reps, 2 sets. Just you have to avoid pain and do nothing without pain. The same if you don't have foam roller, you can do it while the knees are bent and lift up and put it down. Just try not to push your ribs out. So yeah, it's just should be pelvis lifts and you hold for a few seconds and you put it down. This will help to build muscles around the hip. The same, I like very much bands. So you use the band between your knees and you can go by just simple spreads. Or if you don't have a band, it's nothing. You can use your arms. You hold your arms on the knees and you push the knees outside, but with the palms you hold it and don't let it. You have to feel how muscles activates and tries to push outside. The same, you can do little kicks. For example, if you stand next to the wall, you can try to do as much extension as much possible, 10 reps, 2 sets. And of course, the exercise of calf raises. Those have to be done too, to have full extension later on after the physio. Don't be worried about the operation. If you prepare yourself for it, everything will be fine. And see you in the rehab or on the next video what to do next after rehab.